MET and joint mobilization are two treatment techniques which can be given in a patient with frozen shoulder. But do you really know which technique is to be given when? Either of them can benefit the patient, but which one is truly the best choice? Think of it like cooking. You wouldn't add every spice that is available in your kitchen to every dish that you make just because you have it. Great chefs know that it is about using the right ingredient at the right time. In physiotherapy, skill is not about using every technique in every patient, but the right technique at the right time. To choose the right technique, you need to understand two things. First, your treatment goal. What is it that you're trying to work on? What is it that you're trying to achieve? Reducing pain, increasing the range of motion, improving function, etc. Second, which technique works best for that goal? To understand that, you need to know the rationale behind every technique. I use a framework that has consistently worked well for me. I correlate joint irritability with range of motion restriction to decide the treatment goal and technique. Why do I do it this way? Why do I correlate joint irritability and not any other impairment with the range of motion restriction? Because to give any technique, you need to understand the severity of the condition. You need to know at what stage of recovery the patient is, whether it is an acute, subacute, or chronic stage. And joint irritability is one of the most reliable indicators for this. Other impairments like pain is very subjective. It depends upon the threshold of the patient. For a particular patient, if the pain threshold is low, even less pain might be perceived as a lot. So it is not a reliable indicator. Case 1, when the joint irritability is high and the range of motion is restricted. What will be your treatment goal? To reduce pain. Why? Because when the joint irritability is high, it indicates that the joint is highly sensitive and even slight movement will provoke significant pain. If pain is not managed first, any movement will increase the irritation, making it harder to progress with rehabilitation. Which technique would work best for it? I would prefer joint mobilization and not MET. Why? Because both joint mobilization and MET activate mechanoreceptors, which is crucial in reducing pain. But MET, being an active technique, can increase the pain in the acute stage because the muscles are in a guarded state. If the patient tries to generate strength, it will cause more discomfort and irritation, and therefore, grade 1 and 2 joint mobilization is better. Case 2, when the joint irritability is low and the range of motion is restricted. What will be your treatment goal? To increase the range of motion. Why? Because with low joint irritability, the joint can tolerate movement and stress without significant pain or discomfort. So now you can give techniques that will help in improving the range of motion without increasing the symptoms. And therefore, whenever the joint irritability is low and the range is restricted, you need to find out the cause of the restriction. If it is due to reduced joint play, joint mobilization can restore the movement. But if it is due to soft tissue tightness, MET will be more beneficial for stretching and releasing the tight muscles.